This week on Empowering Midlife Wellness, I'm talking about compounding pharmacies and dispelling this rumor that they're bad or wrong, not monitored, not regulated. I'll talk about why you may or may not want to get your medications from a compounding pharmacy versus a traditional pharmacy, and hopefully just dispel some of these myths. Compounding pharmacies are a great option, and so are regular pharmacies. I'll talk about both. Hi friends, and welcome to this week's episode. If you're just joining me, I'm Dr. Susan. I'm a board-certified gynecologist and certified menopause practitioner, and I've devoted the past 5 years of my life to entirely taking care of women in the midlife transition through perimenopause, menopause, and beyond. So everything I talk about has something to do with that. Now, last week, I was talking about different types of hormone replacement that you might choose, what's available, how you might pick the dose. So if you didn't see that one, it might be helpful to review it before I get into today's topic, which is really talking about compounding pharmacies, why some people think they're better than others, why some people are currently talking about ideas like they're bad or compounded hormones are not regulated or monitored or things like that, because that is not entirely accurate. So we do want to get our facts straight. I'm hoping to clear the air a little bit about compounding pharmacies today. So what is a compounding pharmacy? Well, a compounding pharmacy is a pharmacy not like Walgreens or CVS or Rite Aid. It's a pharmacy that has licensed pharmacists specifically making products on their own, which are not coming from big pharmaceutical companies, such the ones that would go to those traditional pharmacies. So generally not covered by insurance because they don't fall under the guidelines from most insurance companies who have negotiated deals with big pharmaceutical companies. So they're making products. Some of them are FDA approved products. Some of them might not be FDA approved products. But in any case, the pharmacist is making drugs for sale to patients in a privately owned pharmacy using products that are not being made by big pharmaceutical companies. Okay, so compounding means they're making it themselves, kind of like a chef would be making something in his kitchen. So there are different levels of compounding pharmacy. They're given names. There's a 503A and a 503B. Well, what does that mean? These are different levels of regulation. And the idea that compounding pharmacies are not regulated or somehow making anything they want to, and you might be getting all kinds of who knows what, is just not accurate. So when you hear doctors talking about that, the truth about that is they do not know how compounding pharmacies work. So I'm going to tell you a little bit about that. So your traditional compounding pharmacy, the one you might have in your neighborhood, the small one that's run by a single pharmacist or a small group, that would be a 503A pharmacy. Those pharmacies are very closely regulated by the state in which they're located. They do have lots of regulations. They, of course, have to be run by a licensed pharmacist. They need to give a product by prescription from a physician, so you can't walk in there and buy something. The bulk materials that they make their drugs out of have to come from an FDA-registered facility, so they can't buy a bunch of who knows what from China and put it in a pill. No, absolutely not. And their products have to come with what's called a certificate of analysis. That means they've tested it and it's shown to be what it is. Now, they can make FDA-approved products. For example, even a patented product, like you may know now that these weight loss drugs like Ozempic, Wegovy, Mounjaro, Zepbound, those are all patented products, but they are allowed right now to be made by compounding pharmacies because the FDA has issued a shortage warning for those particular drugs. So in a situation where you can't get a medication from a regular pharmacy, compounding pharmacies can make exactly the same thing without a patent infringement, for example. So right now, compounding pharmacies can make semaglutide, which is also known as Ozempic and Wegovy. They can also make tirzepatide, which is also known as Zepbound or Mounjaro. So just to say they can make FDA-approved products Or they can make things that are not FDA approved. We'll talk about that in a moment. So many compounding pharmacies are making stuff that you could get from Walgreens, like progesterone. So progesterone you can get from Walgreens. It's FDA approved. You can also get it from a compounding pharmacy. It's exactly the same thing. That would be personal choice, which way you would want to go. It's not better or worse. They are identical, exactly the same thing. Some people prefer a compounding pharmacy for various reasons. One of them is that the compounding pharmacy can make different doses. With the example of progesterone, regular pharmacy has FDA-approved progesterone in 100 milligram doses and 200 milligram doses. Certain patients might prefer 150 milligrams. Well, then they could get it from a compounding pharmacy. So that's a very good example of how a compounding pharmacy is just simply making the same exact thing in a setting where the regular pharmacy doesn't have it, either because there's a shortage or there is not a drug company that makes an FDA-approved dose that you like. Makes sense? So it's not bad. It's just another option that might provide more availability for certain products. So that's your 503A pharmacy, the one you have on your corner that you probably have many of in your city. Now, one of the concerns about 503A pharmacies is, well, it is a bit dependent on the pharmacist doing a really good job. Just like if you go to a restaurant, you're expecting the chef to not give you something that tastes terrible or has poison in it or something of that nature. They have very strict guidelines in restaurants for cleanliness, and we can go to a restaurant and be pretty sure we're not going to die from being poisoned. Pretty much the same at a compounding pharmacy. There's a huge trust element every time you go to a restaurant, isn't there? Similarly, when you get compounded medications, or frankly, even FDA-approved ones, there's a massive trust element that what you're getting is what it states that it is. And so most of us have lived most of our lives with a great degree of trust that all of these different people in our lives that are supplying us with things that we want are giving us what they say they're giving us. And that generally is true. So anyway, the idea that compounding pharmacies are bad or terrible or wrong is just inaccurate for the reasons that I mentioned. Now, let me go on to 503B compounding pharmacies. These are under a much higher level of scrutiny. 503B compounding pharmacies are not monitored by the state in which they're in. They are actually monitored by the FDA. These are federally monitored compounding pharmacies. It's very difficult to get the 503B status. You've got to jump through a lot of hoops, and there are a lot of requirements. Now, they have a little bit of a different setup. These are massive pharmacies that can make medications in bulk and sell them to facilities without a patient prescription. They might supply a hospital with something like magnesium sulfate that could be used for obstetrics or something of that nature. But they don't have to get a prescription from an individual patient. They're not going to be on your corner block. They're big industries that are making drugs for supply to other people. So obviously they need a higher degree of scrutiny. They're still compounding pharmacies. They're registered with the FDA. They are inspected regularly by the FDA. They are held accountable to what are called good manufacturing practices, which is GMP. That requires a lot of different steps. So the idea that compounding pharmacies are not under the scrutiny of the FDA in that respect is completely wrong. So 503B pharmacies would be the pharmacies that make things like hormone pellets. There aren't very many of them in the country. There are actually fewer than 80, I think something like 75 503B pharmacies in the country. So it's very, very difficult to get that designation. But if you're receiving hormone pellets, very likely you're getting them from a 503B pharmacy. Very, very high levels of regulation. So the idea that they're not tested, or there's no science behind them, or there's no validity from outside parties testing them, that's just false. 503B pharmacies are required to do very vigorous batch testing, third-party testing, all of those similar things that the FDA would require for traditional drugs that are made by a big pharmaceutical company. So companies you might have heard of like BioT or Avexius use compounding pharmacies under their umbrella that are in this 503B category. So if you're getting a pellet, chances are it's from a 503B pharmacy. And if you're not sure, I would find out. In our office, we use a 503B pharmacy. Very confident that their products are exactly what they say they are. And now, I like Mel Robbins. I was watching her show the other day, and the person in the interview was stating that we have no idea what's in pellets. It could be anything. It's a proprietary blend of who knows what. Well, that is absolutely not true. The speaker just was not aware of how pellets are made or how compounding pharmacies work. So hormone pellets very specifically have a very tightly measured amount of either bioidentical estradiol, and I'm going to use the word bioidentical loosely because it is a marketing term. Basically applies to any type of estradiol because that is biologically identical to what we made in our body. Another name for that is isomolecular. But the point of the word bioidentical is to differentiate estradiol from other types of estrogen, for example, Premarin, like horse urine estrogen, or other human estrogens like estrone or estriol or plant estrogens. Anyway, to differentiate from those, we sometimes use the word bioidentical. Sure, it doesn't have a scientific meaning other than to say it's biologically the same as what you've had in your body. So pellets can have bioidentical estradiol or testosterone or both. And that's it. And they're in a benign powder. Similar benign powders would be in any pill that you take, like aspirin, ibuprofen. Any pill is packed in a benign powder, something like ethyl cellulose or stearic acid. These are benign powders that essentially no one could be allergic to because you've been exposed to them a million times your whole life. That's all that's in there. There is nothing else. So we know exactly what's in there, and it's very, very tightly measured and tested and validated by outside parties. Anyway, so this conversation suggesting that compounded hormones, particularly hormone pellets, are not monitored, not safe, we don't know what's in there, et cetera, it's just absolutely not right. So, and the FDA is very closely involved in watching over these high-level pharmacies to make absolutely sure that we're safe. So I did want to put that matter to rest. So why might you choose to use a compounding pharmacy? Well, one reason might be because you can't get what you're looking for from a regular pharmacy. That's the main reason. That's why I use a compounding pharmacy for some things. I gave you some examples already, like if you can't get your weight loss drugs because there's a national shortage, compounding pharmacies can make them without a patent infringement. If there's a certain dose that you can't get from a regular pharmacy, compounding pharmacies would be able to make a dose that's in between those that are standard. But again, I will reiterate, those particular products are FDA approved. Just because you're getting them from a compounding pharmacy does not mean that they're not FDA approved. That's just incorrect. The actual product doesn't have a big pharmaceutical company name on it, but the same thing applies. These are generic versions of the same thing that you could get at your regular pharmacy. So another option might be if it's something that we do not have in an FDA-approved form, like testosterone. Nobody wishes more than me that we had an FDA-approved testosterone for women, and I've done lots of discussion about that over the past month. You can look at my videos that I've made about why that is the case. And it's not because testosterone is bad. As I mentioned last week, the American College of OB-GYN, pretty much everybody now recognizes that testosterone is important for women. Clinical trials have shown that it's helpful much more than placebo for treatment of low sex drive or hypoactive sexual desire disorder. So the powers that be recommend that we use it as women if we have that particular symptom. And they also recognize that we don't have an FDA-approved product. So it puts us in a bit of a bind. We have no option other than to either use male products. I touched on that last week, but I want to talk about that a little bit more in a moment, or to use a compounded product. So sometimes there's no other option. Again, testosterone is FDA approved. So in general, the FDA has approved the use of testosterone in humans. So it's FDA approved. Even in pellet form, as I've mentioned before, men have Testapel, which is an FDA approved form of testosterone for men. The understanding from everybody who knows about hormones is that women should receive a dose about 1/10 of that of a man. but it's impractical and just really impossible to get a male dose of testosterone and divide it into 10 accurately. It's just quite difficult. The other thing that I wanted to mention is that when we prescribe a testosterone patch for a woman, and she goes to the pharmacy, not only will your insurance not pay for it because you're not a man, your pharmacist will likely criticize you. They'll think something's wrong with you. I've had patients who had eyebrows raising, like, what are you doing? Are you transgender? Or making other really inappropriate comments about why are you a bodybuilder, or that's not safe, or does your doctor know this is happening, or various other uneducated comments that are not helpful. So patients don't want to do that. It's embarrassing, it's expensive. An option would be just to go get some from a compounding pharmacy. And because I've already told you that it's very safe to do that, and these products actually are very highly regulated, despite what anybody says, they clearly don't know how compounding pharmacies work if they think that there's no regulation. That is an option. Now, if there's an FDA-approved option that is available, it's in the right dose for you, hey, by all means, get that. I am not telling everyone at all that they should use compounded products if there's another option. It'd be fantastic if I could get my hormones paid for by my insurance at Walgreens, but they don't have testosterone. In my particular case, I don't use a patch because it came off because I swim. It's not safe to take it orally, so we're sort of stuck with not having many options. And frankly, if you've chosen to get a testosterone pellet, I'm not saying you should, but if you have made that decision and gone down that path, you can just put estradiol in it as well, and then you don't have to get a patch. So many patients choose to put estradiol in the pellet simply because they're getting testosterone in that way, since we have so few options for testosterone. So in that case, they may be putting estradiol in there just because, hey, we're already putting a pellet in, you might as well get both, and that makes perfect sense. I will acknowledge that there have been cases in the past where compounded products have been less than perfectly accurate. Those are ones that would have come from that lower level of 503A pharmacy that wasn't doing the job that it should. But listen, there's always bad actors in any field, right? There are bad pharmacists. There are bad doctors. There are bad batches of drugs that are FDA approved all the time that are pulled from the shelves because something went wrong and the testing showed that it wasn't accurate. So in the world, this happens. These are human beings making products that occasionally don't come out perfectly, whether they're FDA approved, whether they're compounded. Yes, we want to find a really good pharmacy that we trust. I would, again, why I like checking blood levels, make sure that it's got in it what it says it does. If you're getting something like a pellet, I would certainly make sure that I'm getting it from a 503B pharmacy, which you likely would be anyway. And then, yes, if you can get an FDA-approved option that's not too expensive and the dose is correct, that's a great idea because it's generally easier to get. Insurance usually covers it, and that makes a lot of sense. So there's a perception, I think, that I've heard on some of these podcasts that doctors who use bioidentical hormones somehow are not educated, or they're practicing bad medicine, or they don't know how to use the hormones accurately. Not the case. Many physicians will use both, depending on the situation, because they are educated and because they understand that compounding is an option. So let's think about it. Estradiol is FDA approved. The delivery method doesn't matter. What's approved is the product. And that is because multiple studies have been done showing that estradiol is beneficial for all the things we know about. I'll mention them again: reduction in heart disease, osteoporosis, colon cancer, sexual function, skin, sleep, moods, long list. FDA has approved estradiol because it helps with those things. The delivery method doesn't really matter. The product itself is FDA approved. It just doesn't have a big pharmaceutical brand name on the box, if that makes sense. So going back to this idea that I've heard on a recent podcast that if you get it from a compounding pharmacy and it doesn't have a package insert with a list of risks and black box warnings that therefore it's worse, that is just wrong. It's the same exact stuff. You're just getting it from a different location. Same with testosterone. It is FDA approved, even in pellet form. It's just incorrect to state that that's not true. And I'll say it one more time, even the American College of OB-GYN, who kind of governs what we do in our field as gynecologists, recommends using testosterone for a trial of treatment of low sex drive in postmenopausal women. And frankly, the only way we can get it right now is from a compounding pharmacy. So that's the best we can do. Well, that's what I have to say about compounding pharmacies. I hope you learned something today. If you did, please share it with your friends. Don't forget to subscribe, and I can't wait to see you next week.